What you're about to experience is one man's quest to see beyond the tumultuous period we're in and to envision what lies just beyond our grasp, yet well within our reach. Welcome to Larry Rifkin's America Trends, where the future has arrived, and it's just in time.
On AmericaTrendsPodcast.com, we like to deal with a whole range of issues. Some of them are really difficult to talk about because they're so serious in nature. Now, we try to make them a little more lighthearted and try to kind of ease you into them. And John Krofsick and I are here, I'm Larry Rifkin, to talk about one of those issues that I don't think is on most people's radar, John, but I know your wife works in a hospital, and so you know about this issue. We're talking about antibiotic resistance and the crisis that we're facing.
And as a matter of fact, Frontline did a thing on it. I mean, we are actually coming to a point where you could go to the hospital and for a standard procedure and come up with MRSA or something else. I mean, it's really scary, and they're not developing new penicillins and everything because they don't make any money off them.
And I don't understand.
Well,
I've got to say totally, because there seems to be such an overuse of antibiotics that I would imagine that somebody would be making a lot of money on.
Not to mention the antibiotics they put in the meat to,
Well, that's
right.
one of the
You're
reasons
right.
that we are getting more resistant, because we're putting so much of it, unbeknownst to us, in our bodies.
Right. I mean, it's just spooky. It really scares me, because now you got to wonder when you go to the hospital if you're not going to come out and have some antibiotic resistant.
Well, just think about this, John. If, in fact, we are close to that point, and maybe we're at that point, where that should be a concern on your part and mine. 700,000 deaths worldwide, and there's an estimate that it could go to 10 million because of either the lack of antibiotics or the overuse of them and they becoming resistant and not helping us to ward off bacteria. And think about this, John. Everything in our life, the things that you're willing to take a chance if you were to get on a motorcycle. Now, would you ever be prone to get on a motorcycle?
Yeah, I've been getting on a few motorcycles.
You have
before.
in your life? Yeah. But there's usually a big guy in front driving the thing, and there you are holding on.
Usually my brother-in-law.
Yeah, right. It's not you in the front seat. But think about it. I mean, cancer and all the treatments that are necessary, all the antibiotics that people need afterwards, AIDS, transplants, premature babies, stents, strokes, whatever you may have, antibiotics have to be a part of that process.
You're absolutely right, but we're really at a scary point. I think we're really at a crisis level. We're just, I don't think they don't want to let people know, because if people actually knew what was going on, they would really be afraid to go to the hospital. They really would, or possibly even to the dentist. I mean, you think about
that's
it.
right. Yeah.
It's really scary.
And it's somewhat analogous, I would think, to the overuse of opioids. Now, we've talked so much in our society about the problem we have with these diseases of despair and opioid use. And yet I just read the other day where 1 in 3 adults is being prescribed opioids. I thought that they were really pulling back, but doctors don't seem at all reluctant. You get a skin rash or something, they think, well, let me give you a regimen of antibiotics.
Yeah, well, I don't understand. We seem to have, you can't have pain. Here you've had this massive operation and you're not supposed to have pain. So we've really gotten into this drug, using drugs, and I think the United States uses more drugs than anywhere in the world.
We use an excess of everything. John, how many times have you heard me say, nothing in America succeeds like excess? And this is one of those areas where excess really is not going to be our friend.
No.
And it's not going to tolerate the U.S. absorbing all this stuff, because ultimately as you said, the use of antibiotics with animals. I mean, how much do you read the packaging now to see whether there are any steroids, antibiotics? How have they been raised?
Yeah, we've been much more aware of it when we go. We always try to look for the organic or the more natural stuff because, I mean, you don't want to get that. You just don't want to get it.
Well, we have the sense now that this may be a crisis of some sort, but if you don't go to the hospital, it's never really going to affect you. We don't really think about the fact that any injury can be life-threatening if we can't use antibiotics appropriately, necessarily, and in a more limited fashion than we do today.
No, you're absolutely right.
Well, I had read about a family, John, that really has taken up this cause. They have a project called Nile's Project. And it's an organization that was inspired by Nile Calvin Moss. And at 15 years old, John, he entered this children's hospital in Orange County in California for an annual series of tests. And then he returned home. He began to have flu-like symptoms. And within 48 hours, that was it. His life ended. And they learned that the cause was MRSA infection, and the lack of appropriate treatment and antibiotics from the professionals enabled this sepsis to take over and end this poor young boy's life. And the family, they were unaware of the dangers of MRSA and sepsis, and they weren't prepared. And so they've made it their life's cause now through this Nile's Project. And we want to talk to Ty and Carole, the parents of Nile. But it's a very, very sad story. It really is.
Oh, it's just too sad. And you know what? We got to do something because we don't want any more stories like this. I mean, this is really a bad situation.
And I've got to tell you that this could have been predicted a long, long time ago. And I may bring this back to talk to Ty and Carole about. But let me quote Sir Alexander Fleming, the thoughtless person playing with penicillin. Now, this goes back. Penicillin goes to 1943, I believe.
Right.
So the thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with the penicillin-resistant organism. I hope this evil can be averted. And this is the gentleman who found penicillin.
Wow.
And he could see what was ahead.
Wow.
And our misuse and overuse of it. Why don't we talk to Ty and Carole? And again, very important story. Personally, yes. They'll tell you what you need to know, and I know they're going to give us a lot of information. They don't want to see one more person die of this.
I agree with them,
but they're very concerned, John.
We need to get a hold of this situation as much as we need to get a hold of the opioid situation, and stop it somehow.
You think this is really critical at this moment?
Oh, yeah, I think it is. I think it's a crisis.
All right, well, let's listen to Ty and Carole Moss, and they will help us through all of this information. And again, thank you for being with us today on AmericaTrendsPodcast.com. Well, we are very pleased to have on AmericaTrendsPodcast.com Carole Moss and Ty Moss. Ty is the CEO of Nile's Project, and Carole, who has been serving as the CEO, was named the Chief Financial Officer for Nile's Project. You've got to explain to us what Nile's Project is.
Yeah, thanks for having us on the show today, Larry. My wife Carole and I started our foundation, Nile's Project, after the death of our 15-year-old son, Nile Calvin Moss, in 2006. And that was from an antibiotic-resistant infection called MRSA, methicillin-resistant staph aureus, leading to sepsis. And he acquired that in a local children's hospital here in Southern California. And at the time, we had never heard of MRSA and began to do our research and learned that every year, nearly 2 million people enter U.S. healthcare facilities and acquire preventable infections that are often antibiotic resistant, and more than 23,000 of these people needlessly die from the silent epidemic, and that's according to the CDC's statistics.
And that might shock a lot of people to hear that, because I think everybody has thought that penicillin and other antibiotics are these wonderful miracle cures for just about every bug you can imagine.
Yes, that's so true. And for the past 11 years, we've worked very closely with the Centers for Disease Control, CMS, Medicaid, Medicare, Consumers Union Safe Patient Project, which is an arm of Consumer Reports, But we always like to inform our audience that we're not doctors, but we have acquired much information from our experience, from our other friends and patients' experiences, advocates, and people that are focused on educating and providing data from the CDC and others working on infection prevention. So we all need to get smart about the antibiotics that we are prescribed and that we take.
Well, Carole, I want to go back to 1943. Sir Alexander Fleming, who founded this wonderful antibiotics, if you will, penicillin, and he wrote something, and I'd love your reaction. The thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with the penicillin-resistant organism. I hope this evil can be averted. He saw this even at the dawn of penicillin.
Yes, we're very familiar with that statement, and we are now at the precipice of that thought. Unfortunately, in our research and what we have found is that we, not only Americans, but throughout the world, we have misused and abused our treasure of antibiotics to where the challenges today is that doctors are prescribing antibiotics that are far too powerful, once only used for chemotherapy. Now, if you get a sinus infection, we know that patients are receiving prescriptions for Cipro and fluoroquinolones that are actually deadly and very harmful. This is the challenge we all have in getting to understand what is antibiotic resistance and how can we protect our families from what we have in front of us today.
Well, now we're waking up, of course, to an opioid epidemic. Is there any analogy where we've been overprescribed painkillers, and the whole idea was to keep us pain-free, and that was a good goal, but that was abused? How have we abused penicillin and other antibiotics?
Well, it's very clear. Far too often, physicians don't test appropriately to find out what is your respiratory issue. What is the infection that you are displaying in front of me right now? And the biggest challenge is that they have been writing prescriptions for virus and for bacteria. And, of course, we understand doctors know what they're doing, so we just take these drugs. And so what it's done is we are now immune to the powerful effects of penicillin, and we're having to delve deep into other drugs to try to offset that. But, yes, what we have learned in working closely with physicians, we actually work with physicians and CEOs of hospitals and all kinds of policymakers to really understand what happened to our son Nile, how did he die of a hospital-acquired infection, and what is MRSA. And we learned that methicillin-resistant staph aureus is simply a methicillin, meaning any of the illins, the penicillins, have become resistant because of the overuse and misuse, and the bugs have become superbugs so that they don't react to these drugs that were once very very powerful. The other challenge is that today drug companies don't see the value in developing new antibiotics because the trend is by the time they're on the market for maybe 5 years, they're already showing signs of, immunity. And so they would rather focus on developing things for ongoing pain treatment or ongoing treatment of diabetes. It's not lucrative enough. So this is where we have a very big problem, but we really do have a solution, and it's called prevention.
Okay, and I want to talk about that. But how do we build up this resistance? For example, I can think of many, many cases where for a short stretch of time, 10 days, 14 days, a doctor has prescribed antibiotics for some kind of infection that I might have. And yet I'm reading back, and I talked about, of course, Sir Alexander Fleming, but he recognized as early as 1945, 2 years after penicillin, that this resistance was likely a problem. Why hasn't the medical community been able to react to this? Why do they continue? I don't know how much antibiotics I've put in my body over the years, but it seems rather substantial. So when and how do I build up that resistance?
Well, you build up resistance to even other people in your home or other people right there in your office.
Really? Explain that.
Oh, absolutely. If you're around, let's say if it's your daughter, let's say your daughter has had ear infections from a very young age, and a doctor has prescribed an antibiotic for an ear infection, which is useless. Each time she gets that infection, the bugs that she's fighting now grow stronger, and they're all over your home, they're all over you. So you are directly affected by the people you work with, by the people you live with, and we are all a part of making this a problem, so we all have to be a part of the solution. And that means that we need to get smart about antibiotics. We need to ask questions, and we need to question, before you give me an antibiotic, can you tell me, do I have a virus or bacteria? Because I really don't want to put this risk on my family or my friends. So we need to get smart about asking doctors to test before they give us an antibiotic that's useless.
The other thing, too, Larry, is that you take other countries. Other countries are doing, actually, in some cases, a better job than we're doing here. Take the Netherlands, for example, where you have to basically, they register each doctor's prescriptions that are being prescribed, as well as making sure that they're monitoring. And they basically ask people to wait 3 days. It's actually legislated there.
That's right.
Where they have to wait 3 days to allow your body to see whether or not your body can react and help. As long as it's not a life-threatening scenario initially. But they are very highly regulated, and they've shown really good results because of this, and lowering the use of antibiotics, which has made a big difference.
It is a culture change that we all need to become aware of, and we need to force our medical industry to adopt. We not only are fighting for our health care today, we need to fight for the quality of our health care, because, if you look at the facts, the United States is not rating that high on quality of care. And this is where we need to focus. We need to focus on prevention, and we need to focus on preserving all of the antibiotics that we have today, because future generations aren't going to have them. There will be a day soon that having a tonsillectomy will be life-threatening, and it may not happen. There will be a day when emergency surgeries are needed, but they will not happen because there won't be anything to protect the patient.
Well, this is not fantastical, what you're saying, and yet it is shocking when you hear that. But you've got to play that out, because I want people to understand the life-threatening nature of all of this. I mean, if we knew that any injury could be life-threatening, how would we live our lives? If we knew that we were on a motorcycle and we fell off and we needed surgery and we couldn't use or didn't have, or they were resistant to antibiotics, everything about our lives would change, really.
That's absolutely right. And the other way that it's affecting all of us is that, my husband went to the dentist to just get his teeth cleaned. They put in antibiotics that they didn't talk to him about the antibiotic. There was a bill for $13,000 for antibiotics, and this antibiotic almost killed him, and it's a fluoroquinolin. So they're not only messing around and trying to charge people for the ridiculous cost of these antibiotics, they're not warning all of us of what can happen. And so we can provide your listeners with some very good links to websites that they can look at registered drugs from the FDA to see if there are label warnings, and there are on many of these that we don't know about.
Okay, we will get into that. I want to, but there are so many questions. But Ty, did you want to offer something?
Yeah, I just wanted to offer that we all must get smart about what we're taking and what we're being prescribed. So people need to do the research. They really need to, if you're not real clear on what you're taking and what you're getting, you need to do the research, because that's what we've found, and we have to take that responsibility for ourselves and our family these days, unfortunately.
Well, absolutely.
Every other ad on television these days is about some sort of medication for every little detail that you can think of, and there's 6 or 8 varieties per issue. And the thing is that these are being prescribed. They're given to doctors as just as samples for people to take and to use, and they're giving these things out. And the side effects are just unbelievable. As Carole mentioned about me going to the dentist, just unbelievable. And a lot of these states are not regulated for
monitoring
and monitoring these things. And the dentists in particular, where they're
very big problem.
They're prescribing, but they're not testing. They don't test. I even asked my dentist, do you guys test for MRSA? And he says, we don't do that here. We don't do that. But they're prescribing. But they're prescribing.
And you have an infection in your mouth, and you've been to the hospital. It would be good.
They're giving out drugs.
Yeah.
Oh,
we
absolutely.
Have documented many cases of people either dying or having major problems because of going to the dentist.
Well, I know that worldwide, at least the number that I've seen, is 700,000 deaths worldwide as a result of this resistance to these antibiotics, and it could get as high as 10 million in the period ahead.
And those that you're mentioning, the majority of them are acquired in hospitals and healthcare facilities. And so this is where we need to deal with how do you dramatically reduce the use of antibiotics. And we participate in a presidential advisory committee called PACARB. And what that was is an initiative that said there was a presidential advisory that said we need to address the overuse and misuse of antibiotics and the epidemic of antibiotic resistance. So we fly to D.C. and we will speak for 2 minutes to continue to speak for the consumer and tell them to focus on prevention, because this is how we're going to end this overuse. Each year, as Ty mentioned, nearly 2 million people in just the U.S. go into hospitals and acquire these infections. And these infections are caused by unclean surfaces. They're caused from devices like duodoscopes that are not cleaned and are reused and are still on the market after killing millions of people. There is environmental cleaning deficiencies everywhere. And what we learned after 11 years of our research, and we continue, is that we think hospitals are clean. And we look around and we go, oh, they look pretty clean. When you really get down to it, most hospitals are not clean. And they're not focused on cleaning the devices, the equipment, the facilities, and even the people that care for you and yourself. You can get these infections from a handshake or a hug. And so there are CDC guidelines that are optional that, if followed, we would eliminate millions and hundreds of thousands of these infections and many deaths if hospitals were forced to follow the CDC guidelines of infection prevention, but they're not. It's their choice. And this is where the people need to get educated, and they need to join us all in a focus on the safe delivery of care.
When I look at it, there's one area that we haven't touched upon yet, and it deals with animal antibiotics. And 80% of all of us will then ultimately, through water and dust and meat, find that we are in exposed, conditions as it relates to all of these antibiotics, which are there, to make the animal plumper and to satisfy the bulky interests that we all have in our food consumption. Explain what's going on there and how big a contributor animal antibiotics are to the problem we're talking about.
It's even much larger than healthcare. It is because actually I was invited to speak at the White House when President Obama made this a priority, and he brought in companies like Walmart, like Foster Farms, those people that are raising these animals, and they committed to eliminating antibiotics as a prophylactic, meaning in every day we're going to give them a preventative antibiotic. And the tons of antibiotics that are used in our food every day is finally starting to come down with those who are focused on it. And it's not everyone. But now you could go to Walmart and you're going to see a whole line of chicken that is green with green wrapping on it, and that means never, ever been touched by antibiotics. And they only use the antibiotics if the animal is very sick, and at that point they shouldn't even be selling that animal. But you are correct.
Isn't that one of the reasons that we've been having a difficult time putting together a trade deal with Europe? They don't want what we're giving a lot of these animals, so they don't want our meat. They don't do that as much in Europe. Is that correct?
Well, Europe doesn't have the problems we have. For example, in Germany or even in Saudi Arabia, they have the ability to say, we're not doing this. In fact, Saudi Arabia, and I know it's not in Europe, but it is one of, you would never believe this, but after talking with vendors of devices that are for preventative measures of infections, they're one of the most focused in a country that says, this is what we're doing to prevent these infections, because so many come there at certain times of the year. Now in Europe, the Netherlands has, again, focused on this, and they have overcome the issue as it relates to the farming. They have a very, very incredible farming industry, especially, and we've got films of them talking about how swine was their challenge. They were afraid because of the pigs. Now they're doing infection prevention and have completely reduced and eliminated the prophylactic use of antibiotics, and they are flourishing, and they know that the U.S. can do the same thing if you focus on it. It really is a leadership problem. Our leaders need to make this a priority. And with the previous administration, it was very much a focus. We need to continue on with this, and we need the public to fight.
And what about the medical community? I mean, are antibiotics such a shorthand for here? We'll give them these pills, and it should eradicate the immediate problem, and they just allow that because they're so busy and they walk away? Or what about the pharmaceutical companies? You're saying they're not investing in more antibiotic research. Why is that?
Because for them, they can make their returns are far higher if they come up with a new kind of diabetes medication, or even vaccines and other kinds of treatments that will be ongoing, because they know that, the history has shown, you have an antibiotic that they've spent time making, it will probably, the immunity will come very quickly if you look historically to a map. Quickly within about 3 years or 2 years. They've only got about 2 years until that also becomes immune, and the buildup of resistance is not profitable for them. It's just not their focus.
So are we in a post-antibiotic era already? I mean, where are we in terms of that tipping point where, in fact, we're going to be looking at anything that we do, and we're going to have to really think it through, because without antibiotics available to us, or if they're not really working any longer, we've got much greater risk.
There are bacteria that cannot be treated. One of them is called CRE, carbapenem. There are at least 3 or 4 bacteria that cannot be treated by any antibiotics. We are there for certain bacteria, and it is something that everyone needs to be aware of. In fact, carbapenem was the bacteria that was left inside of the duodecipes that harmed so many patients that were just getting a scope that goes down their throat and into their abdomen to look around. And the reason it was such a big deal was because that was the type of bacteria that was unable to be cleaned in these devices. So, and there is no known treatment for that.
The other thing too is this, for us, our focus is on rapid detection tests that indicates whether or not a person has a virus or a bacteria. Mm-hmm. And what we are trying to do and hoping to do is to find the companies that would develop a home test. I mean, you see these, you go to the store, you see pregnancy tests, you see all different types
What day am I ovulating tests?
All kinds of these tests people can take home. And all we're saying is that if a person takes the responsibility for their own self and families and had a test just to say whether or not, you could swab your nose, and if it turned a certain color, if it was a bacteria infection, then you take that to the doctor and say, I have a bacteria infection, and they can do further testing. But if it comes out and say it's a virus, then you just wait 3 or 4 days, and normally that will take care of itself. We need to be able to test, take that responsibility on as consumers, and that would help to reduce the need to go to the doctor so much. It would reduce some of the testing costs that people have to pay for.
And the time that you wait for it.
So those are the things. Rapid detection is a very, very important point that we're trying to promote and get people to recognize.
Okay, and Carole, you had said earlier that there are approaches. That's one of them. Are there other things that you are recommending that we do with some speed and dispatch about animal use of biotics, or what are the other things that you think we need to do promptly?
It needs to be mandated. And the meetings that we've set on, it is such a powerful lobby, the food industry. They, the committees that are assigned by the president right now are not getting anywhere on mandates to the reduction of using these antibiotics in the animal, food industry. And it's in fruits and vegetables too. So we really do need a working group that is at the highest level of our government that is focused on the elimination of this, and it needs to be right away. It needs to be stat, because right now this continues. The tons of antibiotics that are being used on animals, we continue to absorb in our bodies, which makes us immune. And the challenges are, at this point we've got some big manufacturers that are contributing to it, but it's kind of nobody's pressuring them now because it's not a focus of our government.
Well, when do we get to a point where we say that you are an outlier in terms of social norms? We just can't go on like this any longer. We're jeopardizing our futures. And so it becomes like our smoking campaigns or seat belts or whatever. Do we need to get to that point pretty quickly?
Absolutely.
Yesterday.
We need to get there now. We needed to get there 11 years ago when we found out our son died, and it could have been prevented. It could have been prevented by someone cleaning the MRI table, where he actually died because he contracted MRSA at the MRI table. Unfortunately, the only way that we're getting people to actually move quickly is if this affects their family. And we don't like that to happen, but I served on the California Hospital-Acquired Infection Advisory Committee for 9 years representing the public. And I can tell you that the people on that board are paid lobbyists at hospitals and other governing bodies that are fighting any kind of prevention. The thing that we're dealing with today is that these infections are deadly and they are profitable. There was an incredible series done by Reuters, a 4-part series that we worked on from the very beginning and shared all the pieces of what we're dealing with today. If you read those articles, you'll see that there are 5 stories. Each one of them, the patient acquired the hospital infection, the antibiotic-resistant infection in the hospital, and the bills that the insurance paid to the hospital were $4 million. $5 million, $2 million. These infections are deadly and they're profitable. And this is at the bottom of everything. We don't have state or federal accountability to hospitals that need to prevent the infections, that we know how to prevent the infections. There is no accountability. And this is at the crux of all of this.
Carole Moss and Ty Moss, of course, they are involved and founded the Niles Project. And Ty, I think you mentioned that you would like to make certain that you leave our audience here on America Trends Podcast with some information, some resources, ways that they can study more and understand this problem more than they do today.
Yes. The one site that we point to is cdc.gov/GetSmart. There's a whole series of different information there that they can read and share.
Antibiotic resistance is one of the topics.
Yes.
And antibiotic stewardship is another topic.
Medicare.gov/hospital compare is another site.
This site is run by Medicare and Medicaid, CMS, and it is the results of quality of hospitals. So they can look at their hospitals and find out which ones are doing a good job in infection prevention and preventing harm.
And choosingwisely.org.
And Choosing Wisely is another organization, and it's really co-sponsored with Consumer Reports to educate consumers about tests that doctors often recommend but may be unnecessary, and it gives some questions that the consumers can ask just to be clear and to make sure that this is really a necessary test.
Well, I am so sorry about your tragedy with your son, but you certainly are trying to take that and turn it into a better understanding that will save other lives. So I congratulate you in that effort. Ty Moss, Carole Moss, Nile's Project, and give us your website.
Our website is nilesproject.com, and on there you'll find these sites we just mentioned and more. So please go to our site if you didn't catch all of that information.
All right, very interesting.
Thank you so much. Thank you so much for covering this.
Oh,
we
thank
really
you so much.
it.
Ty and Carole Moss, what incredibly good information, John. And, of course, all of this built out of the tragedy that they sustained, losing their son at age 15. And, again, I know you've been really aware of this problem for a good long time.
Yeah, it's scary. I even worry about my wife, because she's with people all the time, and, it is scary.
Are they taking the appropriate measures within hospitals today?
I don't know, but I mean, they're supposed to wash their hands between, but sometimes there's patients they don't even know that are infected, so they'll go in there and start, and then after the fact, the patient will say, "Oh, by the way," so it happens. So people slide by.
Well, John, I will never forget on the radio program we did, we had a Princeton ethicist. And he was telling us all these stories about things that we do that are unethical or inappropriate and mores that we accept today that we're going to look back on and wonder how, why, how could we? And one was eating meat. But he talked about what we do now to make some of this meat more attractive and the way we bulk it up, for example, with steroids. And I know you couldn't believe this story, but he told it. And I believe it, which is that they have now made these breasts of chicken, or perhaps it was turkey, so plump that they can't naturally procreate because the male cannot even get close to the female, and now they have to artificially inseminate some of these animals. I mean, is that enough to really turn your stomach?
Enough to make you want to not eat that meat, because we really...
Well, that's what he said.
Crazy,
he said in 50 years, we're going to look back and say, how and why did we do that?
Yeah. Oof.
Well, thank you so much for joining us again today on AmericaTrendsPodcast.com. And please help us out. We'd love to continue bringing you this and so much more information. If you find it valuable, you can support us, right, John?
That's right.
Yeah, we've got different ways to do it, so take a listen. If you like this episode, please leave us a kind rating or review. I'm on my hands and knees. Please do it on iTunes because your review is really critical for us to continue providing this podcast. And, John, I know that iTunes looks at this. They want to make certain that we have some rankings, some visibility, and that we're getting some traffic, and then they give you better positioning.
Absolutely. And this way it'll put us in the forefront so you can find us much easier on your iPhone or Android, whatever you may be using.
And they may even send you out an alert. So please, if you can, don't miss a single episode of America Trends Podcast. And, John, they can subscribe on iTunes or Stitcher.com.
And also subscribe on our website.
Oh, absolutely.
We send out a little blurb, and we can also take your emails there at newsletter@rifkinradio.com. That's another way to get us.
And we do not sell or share
No
our list.
spamming, nothing.
Well, I don't know. Does anybody want our list? I don't know, but we don't do it.
Good question.
Even if they asked us.
Even if
Nobody's
they
asked
asked
us.
us.
But
Right.
And when you do subscribe, let us know on Facebook and Twitter. We're getting very active on Facebook and Twitter. Our handle on both platforms, and John, this is really easy, at Trends Podcast. That's it.
That's real easy.
You like that? Did you get that?
I got that.
Okay.
I'm going to have to
give
check
you
it
a
out
quiz.
now. I'm going to have to twit it.
We want to thank you, of course, personally for subscribing. And we also would like to get some of your ideas and questions for future episodes of America Trends Podcast. And that's important, too, because we're all over the map. Our interest editorially in the future, John, has no bounds. But we want to know what it is that you'd like to hear from us. If there was a segment that you'd like to see us follow up on, or if there's something in depth that you'd like us to deal with, please let us know that, too.
We're looking at the future. There's so much we can look at.
Yeah, and the topics that we've dealt with, I mean, we have gotten such incredible guests over the recent period, but they're only going to come to us if they know we've got an engaged and interactive audience.
Absolutely.
So it's really important that you become part of this podcast in so many different ways that we're sharing with you today.
You're absolutely right. We need your support and your help and your reviews.
And your ideas.
And ideas.
Or questions on Facebook and Twitter. And by the way, you can direct message us at Trends Podcast or using the hashtag Trends Podcast. You can also add an email address if you have a public one that you'd like us to give out.
Yeah, good. Hey, and you know what? We didn't mention Amazon.
Oh, yes. We have an Amazon store.
Yes.
And so if you go up, you don't have to buy the things that might be highlighted at that particular time. You can buy any book, and there's some benefit that comes back
Just
to
put
us.
what you're looking at in the little search engine block there, and it'll take you right to Amazon, and it'll help us out.
Absolutely. And it doesn't really cost you anything more because they have built that into their pricing structure. So we get a little taste and you get more programming like this and you get the item that you were looking for. So it works for all of us.
It's a win-win.
Absolutely. Win-win-win.
Win-win-win.
So for more information on America Trends and for the latest updates on upcoming episodes, be sure to like our page on Facebook and follow us on Twitter. You can find us at Trends Podcast. And again, you can find John and I here in our studio performing as best we can for you.
That's right.
And
Let us
making
out.
certain- What's that?
Let
They're
us
not going
out.
to let us out. No one is. Hey, listen, thank you so much for joining us today on America Trends. We'll see you next time.
We hope to hear from you soon.
Oh, by the way, we are posting all the time. And we're posting on Tuesdays and Thursdays.
Good point.
So just be aware, if you're looking for new episodes, they're coming on Tuesdays and Thursdays. When you wake up, before you go out on your jog or your walk and you want to take us with you, we'll be there for you.
Very good.
All right. Have a great day.